What you're looking at on your screen right now is foot rolling with a ball. This technique goes way beyond just addressing foot pain or providing temporary comfort. When you perform foot rolling consistently, you're actually rewiring how your nerves communicate throughout your body, restoring your natural balance, and creating wellness benefits throughout your entire system. So, in this video, I'm going to walk you through the exact way to do foot rolling properly and explain what health improvements you can expect to see. You'll be surprised at how this one simple activity creates benefits that spread far beyond your feet, affecting your neck health and even how your brain works. Hi, welcome to my YouTube channel. Ball rolling on your feet is incredibly effective if you're dealing with foot pain, specifically plantar fasciitis. It's also going to provide relief if you're struggling with knee discomfort, hip pain, chronic lower back issues, or stiffness in your neck. Why does one exercise help so many different areas? Everything in your body is interconnected. When your feet are strong and functioning well, your walking pattern improves. Your entire body posture becomes better because your feet are supporting all your body weight and propelling you forward. When your feet are in good condition, your knees stay healthy, your hips function better, your lower back experiences less strain, and your neck maintains proper alignment. This foot rolling exercise is particularly valuable if you have flat feet and helps reduce leg swelling. I recommend it to most of my patients who come with pain in any joint. The correct technique. Start by sitting comfortably in a chair or on the floor with your legs extended. Position the ball directly under the center of your foot, right in the middle of the arch area. Now shift your weight forward carefully until you feel the ball making contact with your foot. Your body weight should rest on the ball, creating pressure but not so much that it becomes painful or uncomfortable. Begin rolling the ball underneath your foot in different directions. Roll forward and backward, side to side, and in circular patterns. The most important instruction here: don't roll directly over bones or bony areas. Stick to the soft tissue of your foot, the muscles and connective tissue. Avoid the heel bone and the balls of your feet bones. Keep rolling for 1 to 2 minutes on each foot, taking your time to explore the entire surface. As you roll, you'll discover tender areas, specific spots that feel particularly sensitive or uncomfortable. These are areas where tension has accumulated. When you find these tight spots, concentrate on that area for roughly 15 seconds, applying steady, consistent pressure. Focus on maintaining contact with that tender point. After 15 seconds, go back to rolling the ball across your entire foot using whatever movement pattern feels most comfortable for you. You can change directions frequently, roll in straight lines, make circular motions, go diagonally, whatever feels natural. This variety ensures you're treating the entire foot properly. After about 15 days of consistent daily practice, you'll notice the discomfort starts fading noticeably. The pressure sensitivity decreases. Your feet will feel less tender. This is your nervous system healing and adapting. Once you've built this habit in the sitting position and feel comfortable with it, you can progress to doing the same exercise standing up. When standing, position the ball under your foot and shift your body weight onto it positioned under your foot, adding as much weight as feels manageable and comfortable. Start with light pressure if you're new to the standing variation. You can gradually increase pressure as your feet adapt. After 15 to 20 days total of consistent practice, you've become proficient with the technique. At that point, perform this exercise daily if possible, or at minimum 3 to 4 times each week. Make this a permanent part of your routine for the rest of your life. Why this exercise works so well. Foot rolling activates sensory nerve endings throughout your feet. Your feet contain an enormous network of sensory nerves, more per square inch than almost any other part of your body. When you roll the ball on your feet, you're sending powerful signals to your nervous system about pressure, texture, and sensation. This stimulation is incredibly important because your feet are constantly communicating with your brain about balance, position, and movement. This nerve stimulation increases your parasympathetic nervous system tone, your body's relaxation and recovery system. Think of your parasympathetic system as your body's healing mode. When you activate it through foot rolling, your body shifts out of stress mode and into recovery mode. Your digestion improves significantly because your parasympathetic system controls all digestive processes. Your stomach produces more acid, your intestines contract properly, and your entire digestive tract functions more efficiently. Your body recovers more efficiently from stress and physical activity. Muscles repair faster. Inflammation decreases. Your nervous system balances your blood pressure, keeping it more stable and consistent. Your heart rate becomes more regular and controlled. Your cardiovascular system works more efficiently. If you're looking to reduce stress and lower cortisol, the stress hormone your body produces in response to stress, foot rolling supports this goal beautifully. When you're stressed, your cortisol levels rise, keeping you in fight or flight mode. Regular foot rolling counteracts this by activating relaxation. Your brain function improves noticeably, your thinking becomes clearer and sharper. Your mental fog lifts, your mind feels more focused and present. All of this happens from rolling a ball under your feet. The ripple effects touch your brain, your nervous system, your skeletal structure, your mental state, your digestive system, and your overall well-being. Consider this. Your feet are your foundation. They literally support every ounce of your body weight. When you strengthen and maintain your feet through rolling, you're supporting every system in your body from the ground up. Strong feet mean a strong body, a calm nervous system, and a clearer mind. Frequency guidelines. Starting out, do foot rolling once daily for the first 15 days to build the habit and allow your feet to adapt to this new stimulation. This initial period is crucial because it establishes the practice as part of your routine and gives your nervous system time to respond to the increased sensory input. During these first 15 days, you're training your body and your mind to prioritize this self-care practice. After that initial 15-day period, you can adjust to doing it every day or reducing to 3 to 4 times per week, whatever fits your lifestyle and schedule. The key is consistency. If you stick with this practice daily, you'll see faster results and more dramatic improvements. If you do it 3 to 4 times weekly, you'll still see excellent results, just over a slightly longer timeline. The important part is doing it regularly without extended breaks. Think of it like brushing your teeth. One brushing helps temporarily, but consistent daily brushing maintains healthy teeth. Similarly, consistent foot rolling maintains healthy, strong feet and all the cascading benefits that come from that foundation. Even if you have a busy schedule, just 5 to 10 minutes of foot rolling several times per week will make a significant difference in how you feel. Once foot rolling becomes ingrained in your routine and you're reaping the benefits, you can adjust the frequency based on how you're feeling. Some days you might do it once, other days twice. Listen to your body and give it what it needs. What to expect in your first month. During the first week, you might experience some discomfort as your feet adjust to the pressure and stimulation. This is completely normal and expected. Your feet have probably been neglected for years, so they're sensitive. The discomfort should be manageable, not sharp pain, but a sensation of pressure and tightness being released. By the second week, many people notice the discomfort starting to decrease. Your tender points become less tender. You might notice your feet feeling more relaxed after each session. Some people report sleeping better at night because the parasympathetic activation from foot rolling promotes better sleep. By the third week, you should notice more significant improvements. Your walking might feel easier, your balance might improve. If you had foot pain, it should be noticeably reduced. Your energy levels might increase throughout the day because your digestion is working better and your nervous system is more balanced. By the end of the first month, you should have experienced meaningful changes. Your feet should feel stronger and healthier. You might notice improvements in areas you didn't expect. Perhaps your knee pain is less, your back feels better, or your stress levels have decreased. These are the cascading benefits of establishing healthy feet and activating your parasympathetic nervous system. Foot rolling is straightforward and transformative when done consistently. Start in a sitting position, progress to standing, roll the ball across your entire foot while avoiding bones, and spend focused time on tender areas. Do this daily or 4 times weekly for 15 to 20 days initially, then maintain it for the rest of your life. Strong, healthy feet create good walking patterns. Good walking patterns create good posture. Good posture creates a healthy spine and joints. A healthy body supports a healthy mind, better digestion, and a healthier stress response. It all connects, and it all starts with your feet. Make foot rolling your routine. Try it. Build it into your daily life. This simple exercise will transform how you feel physically and mentally. Give this a try. Share it with others. Subscribe for more health techniques. See you in the next video. Stay healthy. Stay happy.